Hi, hello everyone. This is Dr. Angela Gala Gonzalez with Dr. Gala Health Coaching LLC, and I'm here today to communicate again around the current situation and the changes that you are seeing around the management of the coronavirus 19, the COVID-19 pandemic and the response in our city. As most of you know, starting May 1st, you have seen that there is a moderate opening of some institutions, especially small businesses, and kind of people are returning to be outside. And lots of people are enjoying the situation. However, we haven't seen that much of shift on the reduction of cases or the reports continue to be worrisome, and there's some measures we have to um, kind of reinforce in our community. We must be committed to really take them into account and make sure that we are protecting ourselves and protecting our community and our families. So recently, I guess it was today, I was reading, yes, it was today, this morning, I was reading a communication from WHO where they were again bringing up these the results of some investigations regarding the virus and how it is disseminated or spread in the environment. And one of the things that really was highlighted in that communication is that you don't need so the use of mask is not necessarily the best protective measure. And in fact, if you're keeping social distance, and that is 6 feet from other people that I mean, not even if they have symptoms, it's just keeping that social distance between um, people in the community anyways, because you never know who is carrying the virus. Now that there's more information regarding the behavior in and how it manifests in different people, you find people that don't have symptoms at all. They just they don't develop any symptoms. They are um, fighting the virus and they just carry it, and they will be able to transmit though. So we have to take that into account. That regarding the weight of the virus, we already knew that it was heavy enough as to stay in the environment. I remember one of my transmissions before I was talking about that is very unlikely that the dimensions that were described for this virus would be consistent with the virus staying in the air for long. That will not that should not happen. That would not make sense for it to stay in the air. So now WHO is revealing some of the results of studies done internationally by the scientific community. And one of the finding is that the virus will not last that just for a few seconds. When somebody sneezes or somebody is coughing, the virus is going to be propelled at least 1 meter from that person. It's like 2-3 feet probably from the person, and it will precipitate really quickly to the soil or the surface, wherever it has the opportunity to fall in. So hygienic and hand washing and social distance are the main measures that we have to keep, that we should be compliant with, that we have to stress our community to really observe them. Touching things and washing your hands and carrying with you this hand sanitizer, alcohol based. I mean, that is a primary measure that you should take with you, that you should practice in a daily basis, not in the daily basis only. I think is constantly, you know that will contribute to reduction. I have to highlight, and I want to highlight this talking about some measures that some countries that are, we see that they were successful controlling the disease, should be taken our health authorities. And I want to clarify that I'm not here, I'm not representing any other organization, but my own opinion as I'm epidemiologist. I'm a physician epidemiologist, and I've worked in epidemiology for quite a long time, especially in my country, during other situations of international spread of diseases. But I'm not representing any organization. I'm just communicating my worries, and as part of this community, just making sure that my commitment with you, with myself, with my family, is just put outside there as my I mean as a way of just collaborating. So um, just going back to what I was talking about, some countries that have been successful on controlling the disease, just for example, Vietnam, I've seen that they've used not only the recommendations for people to be compliant with specific hygienic measures, but they also added some treatment or management of environment. You know, there are so many surfaces in the I don't know how to say that. I hope it's okay and you're understanding. But I'm trying to say is that um, the virus is out there over any surface that can be treated, that can be cleaned, and that, I think, kind of contributed significantly to control the situation in their countries, and specifically in Vietnam. As I was mentioning, like for example, I was seeing my son is in Vietnam, so I have kind of a lot of communication on what is going on there, and I kind of look for news, like you just trying to take care of, oh my God, my son is there. I have to look at what is going on there and how he can stay safe and protect himself. So I I've seen them using the um, how do you call those? I mean, flies. They had um, sprayed the streets and all the city, for example, with substances that will clean up without being damaging to the environment. And I hope that is considered there, because I just cannot imagine how you will spray the whole city and everything with chloride, for example. Yes, you can use probably something that is not damaging for the um, fauna. How do you say that in English? I mean, animals, insects, butterflies, and so. But at the same time, is um, makes the virus less capable of surviving outside. So this is one thing. Another thing is using the trucks that will be cleaning the streets, and the community can collaborate on this as well. Maybe cleaning up their front side using some substances that will be authorized, and that have the evidence that they haven't been damaging for the environment, and that they will not affect other living beings in the community, and especially yourself. Children play outside. They don't need to get in touch with substances that will be damaging to their health. But this is something I would definitely consider, reducing the opportunity for the virus to survive over surfaces and over the, I don't know, the walkways, and so in our communities. So this is just my probably my concern, and I think is a concern for everyone, because I know economy is so important, and I know they're outside there are lots of people that have lost their jobs, that they are not perceiving any income, and they are going through a very hard situation, even though our government and our authorities have really committed to help people, and that are putting outside there lots of resources to support our communities. But anyways, it is very important to recover from the impact that this pandemic is having on our economy. But we have to be really aware of the danger of, releasing all the measures, and people will kind of be more flexible on whether continue to be compliant with these measures. I just want to call you and please be conscious that your family, your children, your neighbors, yourself are out there being exposed to this dangerous virus, and that we have a duty to with our community. We have to be committed to support each other and really help to control this situation, and in order to be successful in everything. So that was it. I hope this helps to some extent. Um, I know that out there we have a lot of authorities and people that are really, really engaged on trying to solve this situation in the community. And I have to send an applause and really a strong commitment towards our health providers and healthcare frontliners that are there supporting their community and trying to save lives every single day, sometimes at the tail of their um, time being with their families and their own health. So that's something that we have to highlight and we will never ever forget. Now, there was another topic, but I will probably be more kind of a the and I is kind of a, will be devoting a lot of resources to keep contact tracing in the community where we have sustained transmission, which means that we cannot control where is the virus, especially because we have no idea who is infected, not showing any symptoms or very mild symptoms, and not looking for care, or not even looking for trying to get a diagnosis like, well, I'm gonna take a sample and see if I'm positive, or even if I have the antibodies, and I will just try to make sure that I understand what is my condition. So there's not happening, and I mean, if I would guess, that is the general situation. When you compare the numbers, there's plenty of people that have not been tested, that really don't know what their situation, and I have to say that is the majority. So what is the use of exploding or having that much those much resources devoted to contact tracing is something that we have to really manage and very carefully analyze. I would say that one thing that we have to be aware of is and that's applies to everyone, including ourselves, within our families and our communities. We have to be aware of the risk. The the high risk groups have been defined. Please search for documents. I will share as well some of the links that you have available to um, find evidence-based information that is serious, that is real, that is not misleading, that is not misinforming, but is real information that you have to take into account. Please don't follow the rumor. The rumors are important, of course, but it's best before you start spreading rumors that you have verified um, the truth, that that is real, that that is not part of the intention of some people of misleading or intentionally misleading, or just looking for some some kind of role or presence in the media. So I think I've shared everything that was in my mind. I will probably continue to post some of these comments and conversations. I am preparing, and that will be out very soon. I had to change many dates, and I'm sorry for that, for the inconvenience, because I had my mastermind training to be. So it was ready, almost ready to be out there for a presential participation live. So in a place, and then have people coming and participating in that mastermind training, but not anymore. So we are going online, and we are making sure that all our contributions through for training are available online. This first training is absolutely free. I want you, because first is something that I believe is so needed in our community. People need to have ways to cope with these hard situation we've been involved with in since we started this isolation and social distancing back in February. So, or March, yeah, some end of February, beginning of March. So I will invite you to please follow up, keep on the loop what I will be posting to let you know when we will be there. I have to tell you, it is very, very interesting. It's not because it's not coming from me only, but I'm really getting a lot of highlights and a lot of very strong tools and supporting strategies coming from people that are really good at it, that probably are not accessible for everyone, but I have the commitment to bring some of these to you. So keep on the loop. I hope to see you very soon around here, and thank you very much, and you have a wonderful, blessed day. Thank you so much. Bye bye.